Breathing the in, drive the leg up, hold for 20 seconds. Try to bring the toes to your nose, feeling the stretch behind the back of the leg. Afterwards, bring the opposite leg in, feel a stretch. Again, toes to your nose, feel a stretch behind the back of the leg. This can also be done with opposite leg and extension. Again, drive the knee to your chest and drive the heel to the ceiling, feeling the stretch behind the back of the leg, holding between 20 and 30 seconds. Go to the edge of pain, do not push through pain. Hamstring modification 1. Sit on edge of the chair, extend one leg. Chest stays tall, look forward, lean forward, feeling stretch down back of the leg. Again, pointing toes to nose. Hold between 20 and 30 seconds, go to the edge of pain, not push through pain. Hamstring modification 2. On stool or step, again extend leg, lean forward, chest high, pivoting at the hips, looking forward, feeling stretch down the back of the leg as you pull the toes to your nose. 20-30 second hold, push the edge of pain, not through pain. Exercise 2. Start with both legs in a flexed position, neutral spine. Gently rock back and forth both legs to tolerance of what your spine feels comfortable with. After a minute or so of rotation back and forth, you can then proceed into the AB or abduction-adduction exercise of the hip, gently externally rotating one hip at a time while maintaining the other knee in a static position, and then alternating to the opposite side, doing half a dozen to a dozen per side. Again, edge any source of pain, not pushing through pain. The seated modification for the hip abduction-adduction is as follows. First, again, rotating and warming up the spine and hip region with a gentle rotation of the upper extremity on the lower extremity, trunk on body. Then slowly opening and closing one leg from the other. First one side back to center, then the other side back to center. Again, repeating half a dozen to a dozen times. Edging pain, don't push through pain. The next exercise is for the hip flexor, the front of the leg that is down on the ground. Gently place both arms on your front leg and gently lean forward, again keeping chest high. Careful not to arch the back too much, feeling a stretch in the front of the lower leg. Again, holding between 20 seconds to 30 max, but again, edging pain, don't push through pain. Modification for the front hip stretch. On chair, scoot to the side of the chair. Drop the leg to be stretched down and back as far as you can tolerate, anchoring the toes in the ground. Again, leaning, in this case, now leaning backwards over the anchored hip and leg, feeling the stretch, in this case, the right leg lowered. Holding to tolerance, 10, 15, 20 seconds. Again, edge pain, don't push through pain. The next exercise, the knee hip flexion on all fours, also known as quadruped rocking. Start in a quadruped all four position. The key is to have legs spread apart wide enough so that you have room to rock back. And gently rocking back, stretching the back of your hips, knees, and lower spine, feeling the stretch again to tolerance. Pause and hold for 5 seconds and return to neutral. This can be repeated 6 to 10 times. Modification for the quadruped rocking. Start at the end of your seat, hands on thighs, and slowly slide hands down the front of the legs. Go to tolerance of flexibility. At that point, grab the legs and give yourself a slight, gentle tug towards the ground, pulling head down. Feel that stretch, pause, edging pain, not pushing through pain for 5 seconds, and return back to center.